Patriots, bird flu mutations have been discovered. We have rising concerns about vulnerable populations. A prominent health expert has come out and said, hey, we need to take immediate action on this bad boy. Is this the makings of another pandemic narrative? And why does the timeline seem so politically motivated? We're going to break it down for you here on The Bald Brad Show. Welcome back, Patriots, to The Bald Brad Show, where we break down stories that the mainstream media doesn't want you to know about. And today, we're connecting the dots between the bird flu cases in the United States, calls for vaccine distribution once again, and how this mirrors the COVID-19 playbook. Check out this clip from Dr. Leana Wen, former Baltimore Health Commissioner, calling on the Biden administration to act fast on this H5N1 vaccine. Check it out.
There are two main things that they should be doing in the days that they have left. The first is to get testing out there. I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not. And the second very important thing is this is not like the beginning of COVID where we were dealing with a new virus, we didn't have a vaccine. There actually is a vaccine developed already against H5N1. The Biden administration has contracted with manufacturers to make almost 5 million doses of the vaccine. However, they have not asked the FDA to authorize the vaccine. There's research done on it. They could get this authorized now and also get the vaccine out and to farm workers and to vulnerable people. I think that's the right approach because we don't know what the Trump administration is going to be doing around bird flu. If they have people coming in with anti-vaccine stances, could they hold up vaccine authorization? If they don't want to know how much bird flu is out there, could they withhold testing? I mean, that's a possibility. And I think the Biden administration in the remaining days should get testing and vaccines widely available so that at least it empowers state and local health officials and clinicians to do the right thing for their patients.
Dr. Wen, is bird flu in humans super dangerous?
Well, the World Health Organization estimates that in prior outbreaks of the bird flu, that the mortality rate is 52%. 52%. However, in this most recent outbreak, it seems that most cases have been mild, and maybe some people even have asymptomatic infection. But the question is, we don't know what happens when bird flu affects more vulnerable individuals. People infected so far in the US have been mainly farm workers who are working, presumably generally healthy, as opposed to what happens when you get to children, to pregnant women, to older individuals with chronic illnesses. We don't know how deadly, how dangerous bird flu is going to be for those individuals. And again, that's one more reason why we don't want it to spread and acquire more mutations.
Does nobody else find it slightly interesting, the timing of this whole thing and the urgency that Dr. Wen is pushing forward, just as the Biden administration has been facing criticism over what it's done over the last 4 years and the lack of transparency that's come from them? While I agree that preparedness is a little bit essential, the polarization of public health, well, that is a road we've been down before, folks. And let's just say it didn't end well. Let's not forget what took place in the early days of COVID-19, where these so-called experts told us to just sit back, wait and see, let's watch what happens. And then when we did, they imposed draconian lockdowns and mandates upon all of us. Now, we're seeing a similar narrative unravel before our very eyes, where there's these mild cases in the United States, and now what they're trying to do is call for widespread vaccine distribution before the situation has even evolved. It's wild. Folks, here's what the CDC has said. It says mutations found in the Louisiana patient's case could make the virus more infectious to humans. While they claim these mutations aren't widespread in nature, experts like Dr. Wen are pushing for vaccines and rapid tests. But here's the question. Is this genuine concern for public health or another opportunity to exploit fear for political gain? Well, whenever there's a crisis, you seem to have these politicians that want to take a hold of that and do a lot of things with it. Now, we're already seeing some economic consequences, rising egg prices, poultry shortages, and even cases of bird flu in pets, like a house cat in Oregon. Sound a little bit familiar, folks, to what we've already seen in the past? Think about the supply chain disruptions and the inflation triggered by COVID-19. It's as if we're seeing deja vu all over again. The real question we should all be asking ourselves is, what's the rush? I mean, if the vaccine is already available, why not push it out to high-risk groups? Say like, I don't know, farm workers. Why is it the Biden-Harris administration is sitting on their you-know-whats, utilizing Dr. Wen's statements to push a sense of urgency, to craft another narrative? And my question to Democrats is this about protecting Americans, or is it about political optics once again, where you guys never want to let a crisis go to waste? Because a lot of this stuff already played out during COVID-19, where you're crafting specific messaging, using various political strategies, controlling the narrative with the mainstream media, all the while you were both rubbing the shoulders and the gross feet of Joe Biden. And not to mention, you Democrats and media had to completely disregard the whole economy aspect of things and the personal freedoms of everyday Americans. And now what it seems like is Democrats and Joe Biden are crafting a whole nother stage here of narratives surrounding this health crisis around the bird flu. And it's all taking place just a couple days, if not weeks, before Donald Trump is supposed to take office. It's a little odd to me. And my antennas, like I said, are going through the roof. Now let's learn a little bit about what COVID taught us about the dangers of bureaucratic inefficiencies and political games, because the Democrats love to play that. We can do this the right way, where it presents an opportunity to conduct this whole thing without overreaching. You could do this through targeted vaccination of high-risk groups, for example, like farm workers, and transparent communication, which the Democrat Party lacks in greatly, as we saw from Karine Jean-Pierre, Jen Psaki, Joe Biden, John Kirby, Jake Sullivan, and the whole brigade over there. And also avoid unnecessary fear-mongering that, again, the Democrats and the mainstream media love to do. As they've said, specifically, you had CNN come out, Charlie Chester, the CNN director, go, oh, well, fear sells. That's why they love to push it. Now is the time to hold all these leaders accountable, as well as the mainstream media, where public health decisions should be based on facts and preparedness. And when you have conservative Republicans come out with those facts, you shouldn't silence them and ban them from platforms like YouTube, Facebook, and others. You should allow free speech to thrive so the truth can get out to people, and not push this political timeliness where somebody's about to take office and you want to push a sense of urgency in a political crisis, once again, a health crisis upon the American people. Now, conservatives warned about this during COVID-19, and here we are once again with another health crisis, another fear-monger coming out from the mainstream media of the Democrat Party. It's almost as if history is repeating itself. So what's the broader implications of all this? Because it's not just about bird flu and COVID-19, it's also about trust and power. Now, don't get me wrong, there are parallels that you're seeing with bird flu today and the early days of COVID-19. That's all undeniable. But we were told not to panic. But we were also told to trust the experts, the same experts who waited too long to act decisively and then overreacted with policies that crushed the economy. They stripped us of our freedoms and left millions wondering if the cure was worse than the disease. And now, as new threats emerge, we're seeing the same pattern, an insistence of centralized authority. We're also seeing top-down mandates and vague promises that the government knows what's best. But here's the truth. The government doesn't. They suck. The bureaucracy doesn't adapt. The same inefficiency that gave us 2 weeks to flatten the curve turned into years of overreach, lockdowns, and skyrocketing inflation. 9.1 inflation, folks. Y'all remember that one? 40-year high. Never seen it in my lifetime. The same people tell us to trust the science, twist it to fit their narratives and political agendas, which we saw. And let's be real here. This isn't about protecting you. It's about control. It's about power, folks. Control of the narrative, control of the response, and control of your life. When they say act now before it's too late, what that really means is give us more power and don't ask questions. They want you to shut up. And if you sit there and go against their narrative, what are they going to do? They're going to make you shut up by removing you from platforms like we saw from Meta, like we saw from Facebook, like we saw from Instagram, like we saw from YouTube, and everywhere else from big tech and social media. But we should be asking questions, because power unchecked is liberty lost. So here's the challenge for everyday Americans. Demand accountability, folks. And I think we're going to get it from the Donald Trump administration. Hold leaders responsible for their failures. Ask why solutions like vaccines for high-risk groups aren't being implemented now. Instead of waiting for the next crisis to just justify sweeping mandates across everybody, a blanket statement. And most importantly, remember this, the government works for us, not the other way around. Because in the end, the battle isn't just about one virus or one pandemic. It's about whether we remain a nation of free individuals or give into a system that sees every crisis as an opportunity to seize more power, like we saw from the Democrat Party. The choice is ours, but only if we're brave enough to make it. That is today's episode, folks. If you enjoy what you saw and heard, hit that like and subscribe button. We do a podcast, an hour-long podcast, Monday through Friday, 6 a.m. Pacific Standard Time. We got a lot of patrons in the live chat that would love for you to come hang out with them, as I would love to hang out with you. Check it out, folks. Hit that like and subscribe button. I'll see you next time here on the Bald Brad Show. Holy Lord, take care, patriots.